infirmity. Health is wealth. You want to learn about health? Family Health is here for you. Family Health is a 90-minute program that looks into the psychosocial and clinical aspects of the society.
With our resource persons, we discuss health issues in down-to-earth terms.
Join us every Thursday from 12:30 p.m. to 1:55 p.m. on 88.4 Royal FM, the Listeners Radio, and live on Facebook at Royal FM Cameroon.
Family Health.
Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease for infirmity.
Hello, beautiful people. Good afternoon. You are warmly welcome to yet another edition of your favorite health program, Family Health, aired only on Royal FM 88.4. On every edition, dear listeners, we focus on health. Today, we are going to look at a particular health problem, health issue that it's very, very common and it's very important to look at. Today, on the program, we have a medical doctor who is going to be enlightening us about this health topic. It is congenital heart failure. That's what we are going to look at, and it is something that we are going to look at it precisely in children. What is this? What are the causes? What are the symptoms? How do we manage this, and how do we prevent it? We will have a medical doctor who is going to tell us all we need to know about this health problem. Aside from that, we are going to have the mutual assistance and solidarity are advertorial in the program, then plus our lone slot, that is the discovery page by Glory Ngange, and beautiful music to entertain you this afternoon. For today's edition, we have a technical team assisting us. It is made up of Salomon Isana, our sound engineer, and our studio's clerk, video editor Brian Bida, editorial coach Nebel Bila Samari, and for coordination, Roger Kiek. General Supervision, the Reverend Pastor Bisai Emmanuel Noel. For presentation, my name is Frinri Crispin. Thank you, beautiful people, for tuning in onto 88.4 and being with us from now to 1:30 p.m. We kickstart with the gospel music.
You more.
The mutual assistance and solidarity are advertorial of the day. On the mutual assistance and solidarity, so we are going to remind our listeners on several aspects, that is contributions, registrations, deadline for end of contributions and registrations, deadline for the raffle draw, and we are also going to talk about the benefits that you can have from the mutual assistance and solidarity after registrations and contributions. We are also going to talk about the different muscle points that we have for the day of today, that is Thursday. Let's move back to registrations and contributions. As of now, registrations and contributions are ongoing at all Renapro Finance SA branches. We thereby call on all subscribers and all mutualists to do well to continue with their registrations, and also for those who registered and haven't done anything or contributed any France CFA, please, we are calling on you guys to be up to date with your muscle account, because time waits for no one, and we are getting closer to the date for the raffle draw. Not only the raffle draw, we are getting even closer to the day of end of registrations and contributions. So endeavor to get yourself registered and contribute if you have not done that. Then if you have registered yourself and you have not yet deposited anything in your solidarity account, we call upon you to please do well to do that, because before you know it, it is going to be the 29th of June. That is the date that everything when it concerns contributions and registrations is going to end. That will be the last day. After that day, nothing will be done anymore. A reason why we always remind our listeners, our mutualists, to please be up to date. And for the registrations, it is done at all Renapro Finance SA branches across Cameroon and in Yaoundé. You can do it at all Renapro Finance SA branch, and you can also do it here at the Radio House Royal FM, located directly opposite Stade Sapeur Mimboman, the neighborhood around this area. You can do your registration, you can do your contributions here at the Radio House, and all inquiries that you will need about the mutual assistance and solidarity will be given to you here at the Radio House and at all Renapro Finance SA branches. Then for those who are in the market, those who are not able to move to the branches, it is possible for you to do your contributions. Everything you need to do about it through the different Renapro Finance SA agents who are moving around. They are going to market, they are going to round street, they are going to different places to ease the job for you. For those who are not able to leave their business places, we have these muscle agents who are moving around and they are dressed in Renapro Finance SA jacket or muscle jacket. You will easily recognize them. So through them you can register and start with your contribution. Then it is also good because on daily basis they can pass at your shop, at your business place, to take your contribution. So it is just an agreement you're going to have with them. So that's it for the registration and the contributions. Then we move over to the mutual assistance and solidarity. We have several categories: those who are still willing to register, those who have no idea about the mutual assistance and solidarity. It is an initiative aimed at assisting Cameroonians build the spirit of solidarity so that together we can help each other build our finances, build our business through the different contributions we make. You know, on the day of the raffle draw, if one person happens to be a lucky beneficiary, that person is going to use what he has benefited from the mutual assistance and solidarity in one way boost his business, and through boosting the business he's going to make more profit, and maybe because the business is big he's going to recruit more people, and these people are now employed because they were not employed. So it's going to create room for employment. It's also going to create room for more money in the society. It's going to improve the living standard of the person's family. It's going to comprise us. It will be given to you by the agency. The second one is Maso Senior. It has to do with people 60 years and above. Yes, people 60 years and above. Then the last category is Maso Corporate. This one has to do with gatherings, associations, developmental groups, meetings, family meetings, anything that has to do with that is an association, that it has to do with a crowd with many people. This is where you guys fall. So you have the opportunity as a meeting, a group, a developmental group, an association to register into the mutual assistance and solidarity and benefit from the amazing things that it has. Then we move over to the benefits that you can have from the mutual assistance and solidarity. Yes, when you're registering, you will be asked to give 10 names of people and numbers of people whom you can benefit from. They can benefit from health assistance at the house of the mutual, that is at the Mami Hospital Complex. Yes, mutualists, that is your hospital, and thanks to that hospital, if you are a mutualist, you are free to register and take part for your consultations. Yes, and your consultations, you will have a reduction of 35% because you are a mutualist, because you're part of the mutual assistance and solidarity. And 10 other family members or friends, whosoever, those you're going to give their names, will be eligible to benefit from that reduction. Aside from that, we are going to tell you that we have muscle points that exist. Yes, muscle points where you can register, you can go for your contributions, you can go for inquiries concerning the mutual assistance and solidarity. Today we are going to look at 4 muscle points. First, it's at Olezwa, Trois Statues. Olezwa, Trois Statues. It's a neighborhood here in Yaoundé. It is at the establishment Irene, Madame Zuga Ohanda Balbin Irene. You can get to Madame Zuga through the line 655-001587, 655-001587, and this is located face opposite Immeuble Rose Centre Administratif. Immeuble Rose Centre Administratif. That is for Madame Zuga Ohanda Balbin Irene, and that does it for the different muscle points that we have in Yaoundé. So we will close by calling on all mutualists, all listeners, to go get enrolled into the mutual assistance and solidarity, as well as continue with their contributions. Those who have backslided, please do well to continue and make sure that you're up to date before the end of contributions, which is slated for the 29th of June 2026. Ladies and gentlemen, thank you so much for your kind attention.
Renaproof offers Maso. Renaproof offre Maso. Ils sont tous devenus propriétaires de villas à partir de 100 francs CFA seulement. Acte 1.
Je m'appelle Makoun Chopsese. J'ai gagné une belle maison. Je dis merci à Maso. Je ne m'attendais pas à gagner une maison. Quand on m'a dit, je ne croyais même pas.
Acte 2.
Ebodine Chama Joséphine, infirmière.
Je suis là, je suis propriétaire d'une villa. Je suis vraiment content.
Acte 3.
Bibagwe Kuma Jimmy.
Moi-même, je n'y croyais pas. Aller souscrire, c'est de la réalité. J'ai souscrit 26 500 francs. Aujourd'hui, je vais recevoir la clé
d'une villa.
Acte 4.
Chami Jacques, technicien en automobile.
C'est une grande joie immense qui m'anime en ce moment parce que avec 26 000 francs, que je ne croyais pas, je me retrouve propriétaire d'une villa.
Acte 5.
Moi, c'est Kamje, épouse Mangwa. La surprise a été très grande. Le Seigneur est merveilleux. Il m'a offert une maison.
Qui sera le prochain bénéficiaire? À la Masso, vivons simplement nos valeurs africaines. Renaproof offers Masso.
They all became proud owners of luxurious villas, starting with just 100 francs CFA. Act 1.
I am called Makunchop Cecile. I want a very beautiful house. I say thank you to Maso. When they told me, I did not even believe.
Act 2.
Ebodin Chama Josephine.
Here I am. I am an owner of a villa house. I am truly happy.
Act 3.
Bibagwe Kuma Jimmy.
Even I didn't believe it. Subscribing is a reality. I subscribed with 26,000 CFA francs. Today, I am receiving the keys to a villa house.
Act 4.
Chami Jacques.
It's a great and immense joy that fills me right now because with 26,000 CFA francs, which I didn't believe, I find myself the owner of a villa house.
Act 5.
I am Kamje Epoze Mangwa. The surprise was very big. The Lord is wonderful. He offered me a house.
Who will be the next beneficiary? At Maso, we simply live our African values.
If you're just joining us this afternoon, you're on to Family Health, and on Family Health today we are going to talk about congenital heart disease. We have in the studio a medical expert, a doctor, general practitioner, who is going to tell us all we need to know about this health condition. But before we do so, we will remind you that our lines are open in case you have any questions for the doctor or any contributions in the program. You can reach us through 71671157321 or 640-613842. Time for us to welcome our guest. He has been here once. It's not his first time being here at Royal FM. Last time he was here, we discussed some amazing topic, and today he's coming back with another amazing topic. His name is Nzol Erwin. Good afternoon, Erwin.
Good afternoon, Crispin.
You're welcome to Royal FM again.
It's been a pleasure to always be here to talk of interesting topics.
So today we are talking about congenital heart disease. We begin by finding out from you, what is that all about?
All right. A congenital heart disease is an abnormality of the structure of the heart during its development during pregnancy. That is, the heart have a certain defect in its structure, and it caused during that period where the heart of the baby is developing during pregnancy. That is the congenital heart disease.
Okay. Developing during pregnancy?
During pregnancy, yes.
Oh, that's so sad. So, what are some of the main causes of that health condition?
Well, we have many causes that have been identified, although in some certain conditions we don't have a precise cause that have been identified. The first cause, we are going to talk of genetic disease. There are some genetic conditions that lead to congenital heart disease. For example, if the family is having a medical history, for example, of the Down syndrome or the Turner syndrome, the child can at the end develop a congenital heart disease.
Okay.
We also have some maternal causes, maternal illnesses. We talk, for example, of mothers that are suffering from diabetes.
Okay.
That is a condition that can also lead to congenital heart disease. We talk of viral infections during pregnancy, for example, rubella during pregnancy. We talk of drugs that people can take during pregnancy, alcohol, smoking, all those other auto-medication drugs that people can take that have that power of creating an abnormal defect at the level of the heart that can at the end lead to a congenital heart disease.
Okay. All right. So, when after giving birth to a baby, how do you know that the baby or the child has congenital disease, heart disease?
Yeah, that's a good question. Before the birth, we can identify the congenital heart disease during the antenatal checkup of the pregnancy.
That is true.
During ultrasound. Exactly. And you know the heart is one of the first organs that has been formed between the 3rd to the 8th weeks of pregnancy.
Okay.
So when it is formed like that, the congenital heart disease can be identified before birth and can permit to take a better management during birth, or even to know how it's going to take place during birth for us to have a better management. Yes.
Okay, that is though that is part of the course.
That is part of the course. Yes. Now after birth, some of the children can be asymptomatic. They don't have no signs, especially when the defect is mild. At the moment when the defect is severe, at earlier age, the child can develop many signs. For example, when he's breastfeeding, he's sweating a lot, or he have difficulties to breathe, or when he's feeding, at a certain moment he becomes blue. That is the lips and the hands becomes blue. That is cyanosis. Or at a certain level, he cannot even have that ability to play with other children. He always feels tired. And when he plays a little bit, he have to take a squat position, just like each time that he plays. He don't have that energy a lot. Yes.
To play continuously.
Yes. And recurrent respiratory infections. They mostly have respiratory infections that are always there. And that's, yes, those are some manifestation signs of congenital heart disease.
Okay, still talking about the causes, can we say that this disease can come from the mother's feeding during pregnancy, some kind of things that she might have taken in? Because during pregnancy they say women shouldn't have alcohol, cigarette smoking and all of that. Can some of those things cause that heart disease?
Yes, exactly. Many substances have been identified that can lead to a congenital heart disease. Alcohol, for example. Taking alcohol during pregnancy is a risk factor for your baby to develop a congenital heart disease. And we have many other drugs depending on the period of pregnancy where you're taking the drugs that can lead to the congenital heart disease. But also at a certain moment, the mother can stay without taking anything following her pregnancy normally, but at the end the baby have a congenital heart disease with no factor that's been identified as the cause.
Okay. That's interesting, but it's so heartbreaking that you give birth to a baby and the baby starts being sick,
Exactly.
Seeing your baby sick, not fine, not able to play with his friends. It's really disheartening. Anyways, let's move over to something else. You said the symptoms is like baby is sweating while feeding, baby is unable to breathe well, unable to take part in social activities because of lack of strength. When it's getting severe, what are other symptoms?
All right. When it's getting severe, the symptoms that we have just cited becomes more major. It becomes really disturbing. You feel the child is really sick. He's not feeling fine. Exactly. So at a certain moment, when the defect is just a mild defect, with age, it can pass like nobody is seeing what is happening. It just passes like that.
Really?
And yes,
it's
and the
possible.
defect it's possible, and the defect just closes itself like that. At a certain moment, it have to be managed, yes, by surgery or medications.
And by surgery, is it always successful?
Now, it is a very complex surgery, but yes, with modern medicine, it is a very successful surgery that is being done. Yes. In the past years, there was a surgery that was difficult to be carried out in our country because it is a surgery that is expensive. The resources that are used are so expensive. So we were supposed to, at a certain moment when the child is having a cardiac defect like that, it's been sent out to Europe, foreign countries, for management.
What if the family doesn't have that money?
Well, it's a very expensive surgery. So if the family doesn't have money, at a certain moment, yes, complications can arrive till death.
Oh, Jesus.
Yeah, if there's no management. But with time now, we have a lot of cardiac surgery that is being done here in Cameroon in the past recent years with the collaboration of other organizations, international organizations that are organizing campaigns here in Cameroon and in reference hospitals that are handling those cardiac defect.
Okay, let's move over to this event. It's a good news. I would say it's a good news coming up for families out there, for our listeners. If you're listening to us this afternoon and that you feel concerned about this, you can get to us. Before we do that, let's have a caller on line 1. A caller on line 1. Hello.
Bonjour, madame.
Bonjour. You're welcome.
Comment allez-vous, madame?
I'm very fine, and you? Please, what's your name?
I not speak correct English, madame.
No problem. You can continue in French.
Please?
You can continue in French. Vous pouvez continuer en français.
Ok, merci. S'il vous plaît, j'ai un souci seulement.
Ok.
J'ai appelé le matin, j'ai participé au jeu concours, mais j'ai pas de numéro de téléphone à tonton Guy Bertrand.
Okay, it's better you call tomorrow when Bill the Rock is around, okay?
Okay, where is that? À quelle heure?
À même heure.
Ok.
Aujourd'hui.
Ok, merci beaucoup, maman. Passez une bonne journée. Merci.
We go back to you, Doctor. We go back to you, Dr. Nzol Erwin, General Practitioner. We were talking about this good news that is going to surely be a good something for our listeners, the public out there. We have the General Hospital in Yaoundé that is organizing a free campaign for surgery. How do I say it? Heart surgery. Is that the right appellation?
Cardiac surgery.
Cardiac surgery, yes, cardiac surgery for children. Can you give us details about everything that concerns this campaign?
All right. As I said previously, our country is funding a lot of money now to handle these cardiac defect right here in our country, not sending patients out of the country again.
Yeah.
And with the collaboration of international organizations, there are some campaigns that have been organized frequently. And actually, starting from tomorrow, that is the 27th to the 7th of March, there is a cardiac surgery only of congenital heart disease that is organized at the General Hospital here in Yaoundé. Yes, so the surgery is 100% free.
Free of charge.
Exactly.
100% free.
Free of charge.
That is, you just need to bring your patient and put them.
Exactly. So if someone have a child where we have diagnosed a cardiac
problem
defect,
disease.
exactly, can just go to the general hospital and get registered for the surgery. Or if somebody is having a child or knows a friend or a family member that have a child that have all the symptoms that we have just cited and need more investigation, it is better for him to go right now and benefit for it.
Okay. So what is the aim of this this campaign that is 100% free of charge? What's the motivation behind it?
Now, because here in Cameroon, if I can say in our sub-Saharan Africa, there is a lot of financial issues, and it is a type of surgery that, as I said, is very expensive. Okay, you can imagine that one surgery can cost up to 3 million. And in our context, there's little, the number of families that can afford the cost is very insufficient. So we have to organize those surgeries to save life, you can say it like that, so that those parents, those children that doesn't have the ability to go to Europe, go abroad, and the surgery is expensive, can benefit the surgery here directly in our country. Yes, without no problem.
Okay. All right, doctor, we are going to come back to you. We have our lone slot in the program, which is the discovery page. Before we come and talk with you, for you to talk, what can you say to the population out there that is going to encourage them to bring their children for this surgery? But that will be at the end of the program. Let's have our discovery page.
Family Health, our discovery, our discovery.
For our discovery page this afternoon is Glory Ngange. Good afternoon, Glory, the discoverer.
Good afternoon, Finyu Crispin. Greetings, listeners. Welcome to another discovery journey with me, Glory Ngange. On today's edition, we shall be talking about a health condition in infants known as Ectopia cordis. It is an extremely rare condition in which babies are born with their hearts partially or fully outside their bodies. It tends to go hand in hand with other birth defects in the heart or belly area. Globally, only 8 of 1 million babies have Ectopia cordis, while most of them are either stillborn or die within 3 days after birth. Experts in health have not clearly highlighted the causes of Ectopia cordis, but possible reasons could be that as the baby develops during pregnancy, physical changes happen that limit its normal growth. For example, fibrous hands can appear on and restrict the amniotic sac which surrounds the baby in the womb, or the baby's chest itself develops in an unusual way that stops the heart from moving down into its normal place, causing both Ectopia cordis and other cardiac problems. Ectopia cordis is also commonly related to defects in the sternum, that is the breastbone, pericardium, that is the membrane that covers the heart, and abdominal wall as chromosomal conditions such as trisomy 18 and Turner syndrome. One recent theory is that some babies lack a certain gene called BMP2, and that makes it harder for the heart to form and the front of the baby's chest to develop. What makes you notice that your baby is suffering from this condition is the heart being outside of the body. The baby might also have midline defects like a split in the baby's face shape, a split in the baby's upper mouth, lungs that are not fully developed, curved spine, and abnormal hole in the diaphragm. Now, this is what pregnant women should do to know the state of well-being of their infant. If your baby has ectopia cordis, you might find out after a routine ultrasound as early as in your pregnancy's first trimester or the beginning of your second trimester. You might need to have another round of ultrasound to help with diagnosis. These results are key in helping you decide how to proceed. If you decide to continue with the pregnancy, your doctor will closely follow your baby's development using a combination of magnetic resonance imaging, echocardiography, a test that uses sound waves to create pictures of the heart. When a baby is already diagnosed with this condition, to help protect it, you will need to give birth by a cesarean section. As soon as it is born, your baby will definitely need extra help to breathe, so the doctors may insert a flexible plastic tube into their windpipe to keep air flowing, and they also may give the baby a special liquid through that tube that coats the lungs, making sure they can take in oxygen well. The treatment of ectopia cordis itself is through surgery. The surgeon and the healthcare team will also place the heart within the thorax and repair any other cardiac defects. Whether or not these surgeries can happen depends on the kind of ectopia cordis. Also, if the baby has intestines or abdominal organs outside of the body, the surgical team will insert these into the abdomen. I know you would probably be asking yourself how this rare condition can be prevented. Unfortunately, there are no known prevention methods. And that was it for today's edition. Signing out.
Pour des déplacements en toute sécurité avec le soutien de MTN, le ministère des Transports vous recommande de voyager à bord des bus équipés des caméras Iman Driver. Pour plus d'infos, appelez le 80 98.
Dr. Nzol Erwin, General Practitioner, before you leave us today, tell us about some ways to prevent congenital heart disease.
All right, as we said, if we have risk factors that can be identified, we can prevent it. And prevention goes with when I'm pregnant, I have to check out my pregnancy each time that the medical doctor is giving me a rendezvous. I have to be there for the screening and all the rest. It permits to identify those congenital heart disease as early as possible and have a better management at the end. Because those diseases earlier it's been diagnosed and better it is. Yes. Now, based on, if you have to talk of the other causes that are genetic causes, chromosomic causes, those are the type of causes where we cannot directly intervene. Okay, we cannot have a way in which you can prevent those genetic disease, but those that can be identified, those risk factors, yes, we can prevent them, as you said.
Okay, then concerning the campaign that is launched by the General Hospital in Yaoundé, What can you say to the people listening to us out there briefly? What can you say about this campaign? What is it that you can say that can encourage those people to come and register?
All right. It is a campaign that can save life. Okay. Better we have the disease that is treated, whether it is surgery or by medication, better it is. And the second point is that it is free of charge. It's free. They are going to ask you nothing about your registration, and you are going to undergo the surgery. Yes.
Okay, so we all are encouraged, in case you have somebody that is suffering from this heart problem, a child, it's mostly children, right?
Yes,
a child that is going through this health disease, please do well to register and save that baby, save that child, and save the family, because if the child is alive, the